I have the great pleasure of introducing another peer friend, actually, who I used to work with when I worked at Spinal Cord Injury Alberta. Going to be speaking about physical fitness after an SCI.
Hi there, everyone. My name is Alex Hepworth, and I'll be presenting your webinar today on spinal cord injuries and exercise. I do apologize in advance. I'll be doing this webinar from home. I'm right downtown Calgary, so if you happen to hear motorcycles here and there, I may just pause for a bit just to make sure you can hear me. And you might be lucky to get a visit from my fluffy assistant, Winston. So he's not camera shy. He'll probably make an appearance at some point, but just giving you a couple warnings here. All right, so my background, I went to Acadia University in Nova Scotia. 2012 is where I got my Bachelor of Kinesiology. Graduated in 2016. Upon graduating, I got my CSEP CEP. For those that don't know, that means I'm a qualified clinical exercise physiologist through the Canadian Society of Exercise Physiology. It allows you to work more with high performance specialization, disabilities, and other things. So upon graduating and receiving my CEP, I moved out to Calgary here. Never been out west, but needed a job. The maritime economy is not that great. So my first job, I moved here actually to work at Spinal Cord Injury Alberta. I've been there ever since, so that'll be 7 years this summer. A couple years after moving here, I also started working with the University of Calgary, where I'm contracted out to work with their functional electrical stimulation bike, as well as personal training and rehab classes for individuals with disabilities and other conditions. Through my time here, I've also been working with the Calgary FES committee, in which case we tried to get our information to the Alberta FES committee with AHS and others. And I've also taken part with the FES International Guidelines, which I believe took a break during COVID, but seem to be back on track now. All right, so get used to this poster. We'll be going through this a lot today. But these are your spinal cord injury physical activity guidelines. There's a lot to break down in this small poster, so that's what we're gonna start with, and that's what we're gonna go through right now. First off, who are these for? And I know that might sound silly because we're doing something on spinal cord injuries, but it isn't necessarily for everyone, just like our regular physical activity guidelines. So what these ones are listed for is for anyone with an injury level up to C3, okay, and from 18 to 64 years of age. And that just essentially means you're an adult. We don't have to worry about you being an older adult or youth. That's what the research is for, and that's what these guidelines are for. So to be very clear with that, that doesn't mean if you have a spinal cord injury and you're under the age of 18 or you're over the age of 64 that you should not be exercising, or if your level is above C3. It just means that that's what the research is for, and that's what these guidelines are for. Everyone should still be exercising. Everyone can benefit off physical activity. If you're outside of those ranges, what I'd say is you're probably just better off going to see a qualified exercise professional before you get started, just to make sure your program is safe. You don't want to deal with any setbacks right when you get started, or have anything, turn you off your exercise program. The other thing I'd say as well is if you deal with secondary complications on top of your spinal cord injury, if you diabetes, high blood pressure, cardiovascular disease, heart conditions, anything like that, I would again go see a qualified exercise professional before you get started. Again, just to make sure there's no precautions that you haven't thought of, and to make sure that everything is safe. Okay, so from there, we're going to start off with what is a starter versus what is an advanced exerciser, right? What does that exactly mean? And so when you look into the poster here, there isn't a huge difference in terms of what you're doing. Whether you're starter or advanced depends on your goals, your abilities, your fitness level, how comfortable you are with working out, how long you've been working out. Chances are, if you're already active, you're in the advanced category, okay? If you were active before your injury, yeah, there might be some changes, but kind of the baseline is, have you been exercising for over 6 months? Especially if it's recent, you're advanced. If there has been a break, maybe you have to build back into your advanced level. But essentially starter is a beginner that has not been exercising for at least 6 months. Now, if you look at this poster, okay, everything is the same for a starter versus advanced, except for your aerobic activity here. So same thing, right? Whether you're starter or advanced, you're doing 3 sets of 10 reps, 2 times per week for all major muscle groups that you're able to do, same. When you look at the aerobic activity, you'd want to start out a little slower, so 2 times a week at 20 minutes. Advanced levels 3 times a week at 30 minutes of moderate to vigorous intensity activity, which we'll go over as well. The idea of that too is also that's your bottom limit of getting those benefits of a starter versus advanced level. So barring going absolutely crazy and destroying your body, generally more is better. Okay, so don't think like, oh, I should be limited to 30 minutes and I should do no more. No. That's not what we're looking at here, and we'll decipher exactly what they mean through starter versus advanced levels and what expectations you're expected to get through those. Okay. So yeah, the last thing for the starter for advanced level would be what does it mean? It means starter means if you're achieving those goals, that is the minimum level of physical activity to achieve fitness benefits. Okay, at the advanced level, with that extra cardiovascular activity you're doing, the aerobic work, 90 minutes instead of 40 minutes, you're looking at additional health fitness benefits, as well as decreasing secondary complications such as diabetes, heart disease, different things like that. Okay, so now let's define a few terms from this poster as well. So what's the difference between aerobic activity and strength training? For anyone that hasn't worked out much, it's a pretty easy difference. Aerobic, think of something that's, it's continuous, might be a lower intensity than strength training. It's designated to get your heart rate up as well as your breathing rate. So some simple examples would be hand cycling, swimming, cross-country skiing, anything like that, right? Strength training, however, is any type of activity intended to increase muscle mass. So generally, when we look at that, and it should not be limited to this, don't get me wrong, but what we're generally looking at is resistance band training, cable training, dumbbells, right? But it's anything that is intended to increase muscle mass. So it does not have to be your typical outing at the gym, is all we're saying for that. Okay, and in terms of their idea of, 3 sets of 10 reps 2 times per week, right? That also has to follow a specific intensity. So if you're doing 3 sets of 10 and you don't feel anything at the end, well, you're not actually making any differences, right? What we're talking about is doing 3 sets of 10 reps. So on your 3rd set, on that 10th rep, you're really struggling to get through it. You're hopefully still able to get through it, right? But if we're only able to get 5 or 6 reps, well, we should decrease the weight or the resistance. If we're able to get 15 or more, we should increase the weight or resistance, right? You're never going to get 3 sets of 10 every single time, because then you're probably not pushing yourself enough. But we want to stay as close to that range as possible, and we can fix the resistance around to make sure that's the case. Okay, in terms of strength training, the other thing we can look at in the poster is specifically says for each major muscle group. All right, now that obviously depends on your level of injury and where you have volitional movement. If you are able to control below the waist, then yes, we should still be working on glutes, hamstrings, quadriceps, calves. If we're able to control at the core, we should still be working the rectus abdominis, your abdominal muscles there, your lower back, your rectus spinae, specifically anything above the waist too is like we really need to work on the pectoral, so their chest muscles, your latissimus dorsi, so your back muscles, biceps as well, but I'd say two of the most important muscle groups are triceps and shoulders, specifically for wheelchair users. Obviously, if you are a chair user, you can think of everything you do, transferring, healthy shoulders, healthy triceps, avoids, a lot of secondary complications, because if you have a shoulder injury and now you can't move, well, you can think about how much complicated that would make the rest of your life, right? Now, in terms of those muscles where we don't necessarily have volitional movement, That doesn't mean we just ignore them and don't work them. That's something that we're going to get to later on in this presentation. There's different therapies for that, but all muscles that, are working normally as they would before your injury or close to it, there should be no difference compared to someone that's able-bodied in terms of being able to work those muscles. Now, we might need to adapt certain pieces of equipment or certain exercises, but we should still be able to do everything. Okay, and next for aerobic activity, we just want to define what is moderate to vigorous activity, right? So a pretty easy example, I believe it was in the posters that we're going through right now, is moderate activity is essentially, I should be able to talk the way I'm talking right now, and the way they put it is, but you shouldn't be able to sing your favorite song, So if you're going for a walk and it's a slightly intense walk, you can have this conversation like I'm having right now, but that might be about your limit, right? Whereas vigorous activity, for example, I always use the talk test. If you're not able to have a full conversation with someone as you're doing something, then you're in the vigorous activity zone, which essentially means your body is demanding more oxygen than you're able to use right now. And that's why you're kind of sucking for wind. And that's an area that we want to be in because that's when you're going to see your greatest fitness benefits. All right, moving on. One last time there. Okay, when, why, and what precautions do we have? So when, pretty simple with when. The only thing I'd say is break it down as well you can to make sure you get rest, right? Because rest is when you're actually building muscle. When you're working it, you're breaking it down. And if you don't have that rest in between, you're actually going to set yourself backwards. Okay, so we need that rest. And the idea is just to separate to get the best bang for your buck, right? To maximize your workout every time. For example, it says 2 times per week of strength training, 3 times per week of aerobic, right? We can all kind of imagine that I don't want to do strength training 2 days in a row. I'm not going to do strength training Monday, Tuesday, and then do aerobic Wednesday, Thursday, Friday. It just doesn't really make sense in terms of, taxing different systems, right? We want to get that rest in between. So, for example, if you weren't working on weekends, if you weren't exercising on weekends, you're too busy, whatever you have going on, really your, best bet for that, 3 versus 2 times a week on Monday, Wednesday, Friday. I want to do my aerobic activity on Tuesday, Thursday. I'm going to do my strength training activity, and it gives me 24 hours to recover from those systems every time, right? 24 hours for each one, sorry, but 48 hours for aerobic versus strength. So basically just separate it as much as you can to make sure you're getting adequate rest is all we're saying for when for your workout. Why? First off, everyone should exercise. Everyone should be physically active. There's a ton of benefits. Everything's in terms of, weight loss, heart health, lung health, your respiratory system, psychological health even. Everyone should be exercising, right? But specifically for spinal cord injuries, due to the injury and what it poses, individuals with spinal cord injuries are 2 to 4 times more likely to develop secondary complications, which, for example, diabetes, cardiovascular disease, heart disease, obesity, all more likely because of the injury. And so to avoid that, we want to get exercising as fast as possible. Precautions. Okay, so few that should be fairly obvious. Skin breakdown, right? We don't have full feeling. We want to make sure that we're checking on those things just to make sure you're not developing any pressure sores or wounds or anything like that. Hypotension. Okay, so if we have no volitional movement in our lower extremities, there's a good chance that we might not have the best circulation in our bodies. So we definitely want to make sure we have a proper warm up and cool down. Potentially longer or just more efficient than someone that's able-bodied to make sure we're getting that blood flow going, and to make sure we're just not stopping at the end, right? We want to do a nice cool down just to make sure we're bringing everything down nice and slow. On top of that, we want to make sure if we're starting a program, check for fractures, and we want to know about bone density, right? If that is an issue beforehand, want to get a scan to see exactly what your bone density is like in terms of weight-bearing exercises or certain other precautions you might have to take. Next, we also have, there's a blunted heart rate response. Okay, so for certain, especially aerobic activity, a lot of the time if you're advancing, you're looking at certain goals, you want to hit certain levels, and a lot of that is based off your percentage of your max heart rate. Okay, and I'm not going to get too much into that, but essentially we want to kind of avoid using that formula when we're working with individuals with spinal cord injuries because of the blunted heart rate response. Instead of using that formula, what we can always use is an RPE scale, rating of perceived exertion, and there's examples of it. We'll provide a sheet for you after this, but essentially it's a rating from 1 to 10. 1 being I'm doing nothing, 10 being, I can't keep this up for more than a couple seconds. And basically you can use that to kind of figure out exactly how hard you're working and what zone you should be in. And again, that's just different compared to able-bodied people that may have that heart rate response is a lot more accurate. Last one is autonomic dysreflexia, especially for individuals with an injury of T6 and above. Medical emergency, we want to stop right away, and we want to be aware, especially for starting an exercise program, if that is something you are prone to. All right, so a few other things that always have to do with exercising but aren't specific to my webinar that we're just going to touch on quickly. Again, if you felt like you're not educated enough on any of these topics, is something you can just research yourself, or again talk to another qualified professional, dietitian obviously for nutrition. There are sleep coaches, different things like that. But when we're looking at nutrition, just some simple things to keep in mind. Want to eat something, whole foods, something 2 hours before. Okay, we want to try and get protein and carbs in immediately after a workout. It's actually most efficient for your body if it's within 15 minutes. Try to avoid high-fat foods because that just affects the digestion of your carbs and proteins that you need as building blocks for muscle growth. Okay, for hydration, we always want to drink before, during, and after. This is especially a big deal for individuals with a spinal cord injury because temperature regulation can be affected through your injury. And if that is the case, obviously if you're dehydrated, that affects you a lot more because you need water to help you sweat to cool you down. Okay, so if you think about aerobic activities, especially if summer's just starting up now, you go outside, don't realize how hot it is right away. You don't want that to just come and slap you in the face because it just hits you so fast. We want to make sure that we're coming into the situation hydrated, right? Easy test for that is just, how clear is your urine? Is actually a very easy one for it. And we also want to make sure that we're loaded with electrolytes, right? So we don't want to be low in sodium or potassium because then that can affect muscle cramps and other things. Okay, sleep. Best case scenarios, we get our 8 hours. Obviously, that isn't always the case. Probably for most people, realistically. But don't forget, one thing I need to tell people is if you had an awful night of sleep, if you're feeling horrible that day, never feel bad to skip a workout or to take it easy for a day, okay? If you are absolutely drained and you want to go and force yourself into a situation like that, you might be doing actually worse for your body than good for it, okay? So just keep in mind, again, this is an excuse if you just had like a bit of a rough sleep, but if you just went through a weekend, your kids aren't sleeping, you feel like you got, 2-3 hours of sleep a night, take a day off, get some sleep, rest up, because again, rest is the most important thing in terms of actually making gains off of this. Next, looking at overuse injuries. So obviously we were talking about before, shoulders, rotator cuff's a big one. And triceps, right? Transfers, everything that we're doing wheeling around. If you wanted to get more into it off what the exercise program is saying, if you felt like you're ever dealing with issues like that, you could look at getting into more flexibility programs as well as mobility programs to help with shoulder health and the other joints, obviously in your upper body and lower body as well. Also, don't forget about other therapies. If you are dealing with that, if you are dealing with pain or discomfort or tightness or anything like that, especially as you moved on and get into a more advanced exerciser, don't be afraid to look into physiotherapy, right? Occupational therapy, massage therapists, acupuncturist, chiropractor. Just find out what works for you and use it when you need it. Okay. These are things that are out there for a reason. Insurance covers it for a reason. And they can really drastically help your recovery and again stop you from getting those overuse injuries and help you live your life more pain-free with a higher quality of life. All right, this is especially for starters or anyone that's recently injured. Um, a lot of you might be thinking like, oh, I know some of the stuff we're talking about, but how can that work for me? All right, there is always ways we can make it work for you. These are a few of the things we have at Spinal Cord Injury Alberta. Plenty more than this, but if we're looking at a few things that might help you, um, the new step right in the middle here is a piece of cardiovascular equipment, again, to get a good full body aerobic workout. You can get your feet in, get your hands in, and even if you can't use your legs, they'll still get a range of motion as you're doing the cardio work with your arms. Okay. I've kind of hidden it here with my recording, I guess, but in the bottom right is a standing frame. So again, if you have something we'll get at later with the FES, but if you have no volitional movement in your legs and maybe you have denervated muscles, this is a piece of equipment that you're able to crank yourself up so you're standing, which also helps with digestion and other things as well. It can limit the muscles in your legs atrophying because you're not weight bearing, which can also help with bone density. If you look at the top left, we have slings, ceiling lifts. So obviously anyone with an incomplete injury. You're looking at the top right, we've got parallel bars there. You're able to transfer people to planks, you're able to transfer people to the new step if they need to, and obviously hold people up in the parallel bars to take weight off if they're just starting to learn how to walk again. And the last one is especially for individuals where it's affected their hand function and grip strength. You can see down there different pieces of adaptive equipment. We have active hands so you can grip things. We have hooks that you can tie to your wrist again so you can grip things. Transfer boards, sorry. Waistbands to help hold you into a certain position, boards to help you move with your hands. Pretty much anything you need, it's out there. You just have to look into what works best for you and your injury. All right, as stated multiple times, I guess previously, we're going to look into functional electrical stimulation. Again, this can pretty much work for anyone that has had a spinal cord injury as well as other neuromuscular conditions, which we won't be talking about here, but just so you know, other neuro conditions, if you're dealing with MS, stroke survivor, brain injury, this can also work for you. What we're looking at here is we've got a functional electrical stimulation bike as well as our Excite therapy. For the functional electrical stimulation bike, we'll get into how exactly it works, what its benefits are, everything like that. It's an upper body and a lower body cycle. Okay, so just to put it out there for people that do have an upper body injury as well, these pads don't just need to be put on, your leg muscles to help improve them. I've got a video of one of our clients, Paul, coming up, who's going to help explain some of the benefits and how he feels on it. But I want you to think at the same time, if that's something where you'd be looking at it for your upper body, just think of instead of the legs, you can still do an arm cycle as well. And we'll go through the differences of those two. And also the one on the right there is our Excite. So the Excite is similar to the cycle, in which case it uses functional electrical stimulation to induce contraction in your muscles. The difference with the Excite is it's specific to movements. So for example, with the bike, again, we're just going consistently like this, right? And that's still great. We're gonna, try and increase the muscle mass in our legs, basically try and get a lot of the same benefits as regular cycling, on top of, improving the connection from, your brain, your nerves all the way down to your muscles, if you're an incomplete injury. But the Excite over here does specific movements. So, maybe we detach them to one arm, and we look at a hair brushing or an eating movement. And it's going to work at a lot smaller muscles. It's a lot more specific in what it does, but essentially, not everyone, but essentially what you look at is, using the FES cycle to improve muscle mass and different things until you get to the point where maybe you're looking at more specific functional movements, at which point we can get to the excite. Right. And this is my good friend Paul. He's been working at SCI for just over a year now. I'm not going to get into it anymore because he probably explains it in this video actually. But here's him on the FES.
Hi, my name is Paul Croizet, and I sustained an SCI on February 16th, 2022. I started rehab in the hospital. Using the FES bike was one of the tools I used. The goal was to build muscle, increase the blood flow, and good for the joints to move. After the hospital, I started outpatient rehab. Started at Synaptic, SCI. I also had acupuncture and massage. 14 months later from the accident, I have about 50 to 60% sensation back. My gait has more normal and sustained. Standing is very little use of the arms now. And I've been doing a lot of single leg work lately. I have tone. I've had tone for about the past 12 months. It's about 2 months since the injury. It spikes with fatigue and the temperature, and also activation. If I try to activate my quad, tone will activate as well. It doesn't help with the therapies, obviously, because I'm fighting myself. I have a FES program now that's intended to reduce tone. It consists of low stim and just sensory stim on the quads and the calves, which are the muscles that mainly activate the tone. Since then, I've reduced my tone and been able to activate my muscles without the tone, been able to go longer in therapy sessions without the tone, and have been able to make greater strides in my progress and overall recovery. Hi. Hi, my name is Paul Croizet, and I sustained an SCI on February 16th, 20.
All right. So again, here's the definition of exactly how functional electrical stimulation works. To make it less scientific, basically, if you've ever been physio, if I put, if I put some pads on my bicep, okay, they increase the electricity in it, increase stimulation. It'll make my bicep contract without me thinking about it. Okay, so when you're thinking about functional electrical stimulation, all it really means is it's timed at a certain angle on the bike. Okay, so I'm working the bike. If I'm going right here, as my leg comes up, okay, if you're looking at your arms, your tricep, okay, or at this point, if it was your legs, your quadricep would contract, comes right down. Once you're down here, okay, you're at a certain angle, your bicep would contract, or your hamstring, if it's your legs, bring you back here, which would continue your cycle. So there's obviously a big difference between an incomplete versus complete injury. In a complete injury, you can't, if you have no volitional movement in your legs, you're not necessarily working with the bike. It's still a huge benefit to reduce secondary complications. Which is also a benefit for incomplete injuries as well, obviously. But with incomplete injuries, you're looking more to work with the bike. You're still pushing as hard as you can with it in order to increase that connection, again, from your mind to the muscles, right? So we can hopefully get that muscle mass up and, your strength up, and then we can start walking again. Right, again, it's just as important for secondary complications. So, if this is something where it's complete injury, never going to have volitional movement in your lower extremities again. This is probably a therapy you're looking at that you should be doing for the rest of your life. A lot of people say like, oh, why would I do that? And how much effort and time it takes. And I think that's, a very easy thing to say until you talk to any qualified exercise professional and ask them, ask them about a pressure sore, or if you get one yourself. I think you would definitely regret not doing this for a couple hours a week just to experience that. So again, reduced chances of pressure sores. There's some, I can't give you a bit possible research getting put into not increasing bone density, but reducing how fast it goes down, increased circulation and blood flow, reduced atrophy to the lower extremities. A lot of people, especially if your diaphragm's been affected and you're breathing through your injury, it's a good cardiovascular workout as well. There's a ton of benefits to the FES, and again, it's extremely important for those that have no volitional movement, and still important for those that do, that are trying to recover from their injury. All right, we'll try and get quick through this. I want to leave a few minutes for questions, obviously, but if we look at the different types of FES, again, there's a few companies that do it, but if we're looking through supine FES there, I believe they have one at Foothills. Everyone afterwards correct me if I'm wrong on this stuff, but they can roll it right up to your bed, so essentially you're able to get cycling almost immediately after your injury. Right after that, on the right, both of those are just the bike I just showed you. One's upper body, one's lower body. The stepper at the bottom, I'm not 100% sure it still exists. And then we've got ellipticals, treadmills. Not 100% sure we have one of those in Alberta. But again, someone correct me if I'm wrong. Please tell me I'm wrong. All right, so contraindications very quickly. We can look at this afterwards. Pacemaker, we're not doing it. Unhealed fractures, no. Pregnancy, no. Rotator cuff tear, it says year there, but rotator cuff tear, we won't be doing the upper body cycle. Subluxation, sometimes that can actually be corrected through it, but obviously if it can't be, we're not doing it with a dislocated shoulder. Other ones for relative contraindications, too much spasticity, you may not even get through the cycle. Pressure sores, we don't want to do that, obviously, especially if it's on your hip or, like top of your hamstring. You just think about your legs consistently grinding against your chair, something we don't want to happen. And plate screws, stimulators, heterotopic ossification, so if I can't get a full range of motion, right? If I'm sitting here and this is as much as I can bend my arm, not good to be cycling through when I almost need it straight, right? So they've got specific ranges of motion for that. And the last one, again, like I mentioned before, is denervated muscles. Okay, so some people unfortunately do not react to the FES. And at that point, if they're putting, I think the maximum is 140 milliamps of electricity into your muscle and you're not getting a reaction, something that would make someone that was able-bodied absolutely scream and cry in pain. Unfortunately, this might not be the therapy for you. Again, there's different therapies on top of it. We can look at the standing frame, different things to get similar health benefits, but not great to be using the FES at that point. So a couple of benefits that we didn't go through. Obviously talked about all the other ones. Improved quality of life overall, great. Decreased spasticity, that's actually something once you've done it a bit, it could actually increase your spasticity the first few times. Improved gait if you're completely learning to walk again. And the biggest one, which as an exercise professional I did not think of at first, that I've heard from pretty much everyone, is the psychological benefit of seeing your legs move, seeing your muscles grow, the way your pants fit, being able to get a cardiovascular workout. From what I've heard from most of my clients, is psychologically is the biggest benefit. And that's it. So I'll cut it off right there. And looks like we still got 6 or 7 minutes here for questions. So thank you, everyone. And
All right, thank you so much, Alex. We do have a couple minutes for questions. We've had some pop up in the chat here, so let me just get back to here. Just trouble getting back to chat. I'm just going to go with one that's more recent in the chat, and then I'll get one that's a little bit earlier. We have a question from someone who says, with someone with long-term injury, 18 years or more, would it still be beneficial to start an FES bike? And how often should it be used?
Sorry, where was that one, Casey?
It's Nancy Benner, just second last question. Or sorry, the last question in the chat box.
Oh, something like 18 years or more would be absolutely. Yeah, it's never too late to start, kind of just like any exercise program, right? You know, one thing would be to make sure, obviously, that after 18 years, you still don't fall under any of those contraindications, like you haven't got any ossification or anything like that. But yeah, absolutely, never too late.
Perfect.
Oh, and how often should it be used? I can actually let Chester talk about this. We have been talking about the international FES guidelines, but I believe what they've set it for is 3 times per week for 30 minutes, I believe is what they've got right now. Correct me if I'm wrong on that one, Chester. It's been a couple years now.
I think, Alex, we're going to determine that together by consensus.
Right, and I think we're starting to get around those ranges, but yeah, that's something that will come out in the future, I guess.
Perfect. Just one last question for you, Alex, here. How long after injury do these guidelines typically apply to? For example, do they apply to those still in acute inpatient settings? And do the guidelines still apply to those with complications such as ICU acquired weakness?
Sorry, what was the complications such as what, sir?
Such as ICU acquired weakness. So maybe we just.
Oh, okay. Sorry, I'm seeing it now. How long? Yeah, I guess you'd want to be, you know, past that stage where you're stabilized again. So no, I wouldn't say necessarily that, you know, obviously within days or even weeks of your injury that you should be aiming to get, you know, 3 sets of 10 reps for each major muscle group, trying to get cardio in twice a week. Obviously there's priorities on top of that. You might be, there might be surgery set up. So I don't think there's a specific timeline for that. It would be more so knowing your body. And again, like we've talked about through other things in this, just talking with your team and knowing when you're ready to get started on that program. Again, that's at a stage with the acute we're talking about. You should be seeing a qualified exercise professional to know where exactly you should be starting at. You know what I mean?
There's a note from Dr. Ho in the chat box there. We do have to move on to our next speaker. So sorry, we couldn't ask more questions. Alex, if you want to take a look at the chat, there was one other one just regarding the FES cycling. If you wanted to shoot an answer to everybody for that one, that would be awesome.
Oh, for the spasticity one there. For a person experienced spasticity, so what I've done with a couple clients is it's almost, because they've got a way you could do an interval thing, is I almost do it like a staircase. So typically, you know, if it goes up 1% a second, it takes 100 seconds for you to build up to 100% stimulation. Sometimes just making that go a lot slower, increasing the time of warm up, because a lot of the times it could be like velocity dependent, right? So if you start up too quickly, if the speed starts too quickly, if the stim starts too quickly, you might get more spasticity that way.